All right. Hi, everybody. Happy Sunday. And thank you all for tuning in and being here with us, whether you're live or watching this a little bit later. My name is Amanda Montgomery. I'm the manager of community health education at Heartland Health Centers. And I'm super excited to be here with Dr. Anuj Shah, Dr. Sonia Oyola, and Stephanie Gordon Rivera to talk about compassionate and holistic ways to manage COVID-19. So I hope you all enjoy. If you have any questions while you're watching, feel free to leave them in the chat and we will try to get them addressed at the end of the conversation or afterwards. And we'll be putting all the links to resources that come up in the conversation in the Facebook chat as well. And then just one final thing, I'm going to let people do introductions, but before we get started, I just want to note that what is said here is not intended for medical advice. And so if you have any questions or want more specific personal advice, feel free to reach out to your primary care provider and talk to them about what your question is or what's going on. So with that, we can get started and just let everyone introduce themselves. So I will pass it off to Anuj, you're first on my screen, if you want to introduce yourself.
Thank you, Amanda, and thank you everyone for joining us. And as Amanda said, my name is Anuj Shah. I'm a family physician and integrative medicine physician at Heartland Health Centers, and I work at the Lakeview location. Thank you all.
Thanks, Anuj. And then Sonia, would you like to introduce yourself?
Absolutely. So, hello, everyone. Good afternoon. My name is Sonia Oyola, and I am also a family medicine doctor working at Heartland Health Centers, also trained in integrative medicine there. And it's a pleasure to be with all of you here today with my colleague Anuj and also with my colleagues Amanda and Stephanie. Thank you.
Thanks, Sonia. And then Stephanie, go ahead.
Hi, everyone. My name is Stephanie Gordon Rivera. I'm the supervisor of community health workers here at Heartland, and I work in helping people get access to vaccines and tests.
Awesome. So of course, I'm so excited to be having this conversation with all of you. I think it's super important and relevant, especially right now with everything that's going on with COVID-19. So I'm really excited to get into this. And since we have two integrative medicine providers, and I want to highlight that today is Integrative Medicine Awareness Day. So it's very timely that we're doing this. But just because we have you both on the Facebook Live, I would love to start by just hearing from you all what how you would define integrative medicine or what integrative medicine is.
So I can start. So integrative medicine is a way of approaching healing and health in a way that looks at root causes. So rather than thinking about people as people with diagnoses, this is a person who has insomnia, this is a person who has, heartburn, this is a person who has chronic pain, rather thinking about root causes of what might be causing some symptoms. And those root causes can be a combination of physical things, but also mental, emotional, social, spiritual things that all kind of come together to in a person's body and expression and what's going on. And it also is a manner of healing that looks at all the tools in our toolbox. So not only are we utilizing Western medicine, which both Sonia and I are trained in allopathic Western medicine. We're both physicians, MDs. So we utilize, medications and testing and referrals to surgeries and things of that nature. But also what are the other tools in our toolbox, which maybe don't get as much press, such as herbal medicine, supplements, nutritional therapies, energy medicine, body work, psychological therapies. So that's a quick way of maybe I might define it. Yeah.
I echo all of Dr. Shah's definition of integrative medicine, and when we completed what's called an integrative medicine fellowship at the University of Arizona, and at that fellowship, what we're also taught is that at the foundation of healing is a relationship with a patient that's based on equanimity, and what that means is that the information that the patient is sharing is just as valuable as the information that I would share with them. So together, that information comes together to form a new idea together. That relationship is based on trust. It's based on mutual respect and kindness and compassion. And so we get trained in a lot of generous listening and motivational interviewing. Really, as Dr. Shah said beautifully, in root causes. And it is evidence-based as well. So what is the conventional medicine that has the most evidence and the complementary medicine that has the most evidence, and how do we bring those together for a specific plan for that individual and family, and again, based on what they value, what they prefer, what they have access to as well. So yeah, that would be what I would add to that wonderful definition that Dr. Shah already shared.
Thank you both so much for sharing. That was a really, really great definition, and was really helpful to understand all the aspects of integrative medicine. And so it sounds like you treat, all aspects of a person's life and really take all of those things into account. And so thinking about COVID-19, I'm wondering how you might think about preventing COVID-19, the prevention side first, from an integrative or a holistic perspective. What might you think about or talk to patients about?
Well, I guess I could start here. Then I would say that the very first, I think, foundational piece to understand is that COVID-19, like any virus that might infect us and affect our body, how it affects our body and the symptoms that may arise from that infection have so much to do foundationally with the status of our immune system. And so I say that because I think it's a good view when you're thinking about prevention. And the preventative pieces, and Dr. Shah and I just talked about this just minutes ago before we got on this call. We both really agree that foundational lifestyle medicine approaches, like getting enough sleep, getting regular exercise, really attending to relationships and how those relationships are impacting our well-being, having as healthy food as we can. All of those pieces are really critical for ensuring that our immune system is as healthy as possible. And so when we are exposed to a virus, any virus, our immune system will be strong enough really to combat that. Now, a lot of times the immune system is like a teacher. It needs instructions in order to specifically help us. And so the other way to prevent an infection, not only catching it but spreading it, is getting vaccinated. Because those are the instructions that our immune system would need in order to specifically prepare us to both prevent our own infection and the spread of that infection. So that's what I would say, that foundational lifestyle medicine approach is very, very important, but also certainly getting vaccinated. And certainly I'll pass it on to Dr. Shah, because I'm sure he can also talk about the vaccine, and also certainly masking and all the other ways that we know to prevent this infection.
Yeah, thank you. Yeah, and this is exactly, I echo all of those things, of course. And, we know so much about how other pandemics and endemic viruses have happened in our human history, and how much vaccines have been so helpful. And we have our own data, right? So one thing that Sonia had mentioned, that, one of our foundational precepts in integrative medicine is really looking at evidence. And so when I'm at least 3 to 4 times a week, I'm checking the Chicago Department of Public Health statistics and where is my community in infection status and hospitalization and in death. And then you can also, on the Chicago Department of Public Health website, you can also see, for those who are vaccinated versus those who are not, what is the hospitalization rate and the death rate, and the evidence is there. So it's important to act on said evidence and get vaccinated. And on top of that, to be in the best health that we can be, right? So for myself, I know that early on in this pandemic, I wasn't exercising as much as I probably should. And I think when things shut down and I wasn't going to the gym, and I was really, thinking about that, and I really reflected on, am I doing the best for my health and prevention? And when I got vaccinated and things started opening up, it was like, I really need to make sure that I am in the best health that I can be, exercising that I want. If I'm someone who's going to be getting COVID, I want to be someone who gets COVID with strong lungs and with a strong heart, as strong as it can be. And it's also important to think about one's community, right? So masking when masking is appropriate, you're in public spaces. It's important. You don't know what another person might be going through, and what affects us affects them, what affects them affects us. So we're all living in the same community as community members. So masking, keeping social distancing, being wise about how much we are in person, depending on what rates are going on in your community and what's going on in a certain circumstance.
Thanks. That's really helpful to hear. I'm wondering too, I know you both mentioned vaccines a couple of times. Do you think that vaccines and maybe wearing masks, are those the best ways that we can prevent COVID? I know there's a lot of other kind of things swirling around on social media or out on the internet that there's other ways that you can prevent COVID. Have you heard of anything else that is effective, or would you recommend vaccines as the best treatment?
Yeah, that's a good question. And I think both Sonia and I get referrals, right, from other providers for patients who may want to take more of a natural approach, or a more and kind of stay away from maybe pharmaceuticals or things that a pharmaceutical company would endorse. And I hear that, I get that. But the science, I think, is clear here that vaccines are where it's at when it comes to prevention. So the short answer is yes. I do think that vaccines are our most important. I don't like to use the word weapon because I don't like to use too much violent analogies, but our best protection, I think, against this virus when we're thinking about prevention. Yeah.
I agree. I think that it's a lot of what I think currently we're living in an age where there is so much information. So I really appreciate your question, Amanda. All of this information, how do you make sense of it? What's true? What's not? What do I follow? My Aunt Martha just got her vaccine and she had X side effect. Or, I heard from, I just read on Instagram a post from a movie star who said, when I caught it, when I got the vaccine, this is what happened. And that's important information. That is not information that we should devalue in any way, but it's also different than a study, where you take thousands of people together and you look at the effect that a certain medication has on that group of individuals compared to not getting vaccinated. That's a very different kind of level of information. So information has different levels in which you can look at carefully to say, I think I can rely on this more to generalize it to my own self versus one particular story where it would be very hard to generalize for yourself or for everyone in the country. So I would say that, you know, it's a challenging time. I feel for everybody. I feel for all of us because we're all trying to read and keep up and see what's coming out, which is true or not true. And what I would recommend highly is whenever you read anything, just ask yourself, what's the likelihood that this applies to me? What's the likelihood that this applies to all of us? Who's writing this? What intention might they have to write this? Isn't it an intention to sell something? Isn't it an intention to protect us as a public? So just those questions, those self-reflections are really important. And if you need anyone to reflect alongside you, I think a primary care doctor, you know, someone who really has had a lot of practice reading studies. It's not that we know more, it's that we have practiced reading these studies more. And it's taken us years and years to read these studies to make sense of them, you know, to be able to tell you, yeah, you know, this makes sense for you. But this may not make sense for you. And so please connect with someone that can help you reflect and go through some of that you're reading so you really get the most accurate information and safest information to make those decisions.
Thank you so much. That's so helpful. And I think you're so right. There's so much information that we get from everywhere. So it's very helpful to have some of those tools to think about the information that's coming through. I know you both also mentioned the role of community and thinking about emotions and the emotional response. And I know that I'm sure for everyone, COVID has been an extremely stressful and overwhelming time. And it comes with a lot of decision making about safety and about our own, you know, comfortability levels. And I'm wondering if you all have any thoughts about whether you're somebody that is vaccinated and is a little bit, you know, concerned about whether other people around you are vaccinated, or if you are just concerned about getting the vaccine or handling being unvaccinated. I'm wondering if you all have any advice or if you've talked about this with patients before, how to kind of navigate those varying relationships.
Yeah, that's a hard one because as much as as much as the science is pretty clear about the importance of getting vaccinated as far as a prevention strategy, the truth is it's scary, right? This is something that we don't necessarily have long-term 10 decades of years of study on this vaccine. We don't, right? And there's some fear there. And I think that's very appropriate and very human to have that fear. I think that now, in regards to that, we do have decades and decades, almost 100 years of study on vaccines, right? And how vaccines work, and this technology is actually an older technology. But I think when I'm approached with someone who maybe hasn't gotten the vaccine or is unvaccinated, there might be a lot of shame there as well for that person. Not only fear, but also shame. I think there's, it's upwards of 65% of the US population is now vaccinated. In Chicago, it's much higher than that. I think we're in the 73% now of vaccination, maybe a little bit more. So that means, this person is doing something already that most people aren't, right? They have so far not gotten vaccinated. And there's a lot of pressure to get vaccinated. So that person already may have heard things that has made them feel embarrassed, shamed for not being vaccinated, maybe feel hurt and unheard. And I think that's important to understand a person's story and to hear where a person is coming from and what is it that that a person is thinking, is feeling, is where are they coming from when it comes to their decisions. And now I come at that as someone who is a physician, and so it is my job to have those conversations, but also I'm coming at it as someone who is vaccinated too, right? So I think that if this is someone who those feelings kind of go both ways. I think for someone who I myself have an immune compromise and a disability. So as someone who feels like it's important that everyone is vaccinated to protect everyone else, it can also feel it can feel hurtful to me, that a person chooses not to get vaccinated, that they're not helping to protect the community. And so kind of understanding there's a lot of layers here of emotion and feeling that goes both ways, and to really try to come at any conversation with an open heart and listening, I think is important. So there's a lot of rambling, but I think, yeah, Sonia.
I couldn't agree with you more that this time has, I think, unearthed and unveiled a lot of complex feelings and complex fears. And I think what Dr. Shah said so beautifully is that we're human. We're all human. We are not only do we ourselves have a personal, feelings about this vaccine in terms of, the collective responsibility to take care of each other and protect each other, protect our neighbor, but also this professional obligation to recommend something that is evidence-based and that it can really help us get through this pandemic and endemic in a much more in a much faster, really faster way than we have experienced. Now we're almost 2 years living through this, and so it's not unusual for all of us to have some degree of frustration ourselves. But we're here to really affirm that our first responsibility with you and with the public is to first do no harm. And we did not go into medical school to promote something that would be harmful. We did not decide to become physicians to promote something that can be harmful but helpful. And while we don't have these 10-year or 20-year studies to look at this vaccine, like Dr. Shah said, we do have many, many years, hundreds of years of studies looking at vaccines and the safety of vaccines. And we also have the recent studies of the actual COVID-19 vaccines where it looked at side effects and the potential side effects and how quickly side effects resolve within 7 days, and the most common side effects, which is soreness of the arm, muscle aches, headache, low-grade fever, that within 7 days is resolved. And so I would say that for the people that are deciding at the present that they don't want to receive the vaccine, it's a very personal choice. It's a very complex choice. We are here to be of service to people, whether you take the vaccine or not. We're here with a lot of openness and curiosity and compassion to help in any way possible. I would also say that this is no time for shame. It's no time for blame or shame at all. Very similar to what people experienced during the HIV crisis, where they were shamed and blamed, and what that led to is people not getting treated, and people treating others in a very ill and harmful way. And so let's not repeat that lesson. Let's stay in a place of compassion and love and say, okay, we're not ready. There's a lot of complex reasons for that. Let's try to figure that out together. Let's be kind to one another. Let's listen to one another and respect each other. And I think with that kind of understanding, we will get through in a way where we feel proud of our decisions, of how we've handled this, instead of instead of handling it in a way that leads to more harm. Okay, I mean, those are my reflections on that very complex question of shame and blame and people deciding or not deciding to take this vaccine. Okay.
Thank you both so much for handling a question that is very, very complex and comes with a lot of thoughts and feelings. But it's really helpful to hear your reflections too on this. So thank you for sharing those. I'm wondering too, in thinking about the treatment side, right? We've seen this spike in COVID rates just recently. And so it really is everywhere. There are a lot of people getting COVID or who have gotten COVID recently. And I'm wondering, again, from an integrative or holistic perspective, how you would approach the treatment of COVID once you already have COVID-19.
Sure, I'll go. So I think there's the science is still emerging, right? So we have some novel treatments which are out there now as far as prescription medications, monoclonal antibodies, antivirals. So I think the data there is still quite early and the availability is still quite early. So, and, this is as of, the end of January 2022 is when we're talking about this. And I know like as of next week, things are going to change, but so some things are emerging. And from what I've seen in the data, it looks pretty early yet. So where I'm focusing right now is on symptomatic care and thinking of it from a mind, body, spirit perspective. So starting with the body, which is sometimes a little bit, maybe sometimes a little easier to deal with. There are the symptoms, right, of cough. I might prescribe some herbals, in particular honey. Honey has like some of the best evidence behind it when it comes to alleviating cough. And some things that maybe have less evidence, but I don't think will do any harm for most people, such as like pineapple juice or a slippery elm or a licorice root tea, that sort of thing. Of course, speak to your own physician based on your own medical issues and thinking about what medications you're on, because all these things could have drug interactions, and for certain people who maybe are pregnant or have high blood pressure, these things may not be recommended. But the point is that there are some treatments that have been used for thousands of years by our ancestors and other ancestral traditions that when used in those traditional ways, I think can be really helpful when it comes to symptomatic treatment. I'm not a big fan of like mega dose supplements of for example, like certain vitamins or things of that nature, because that isn't the intended way of using those, and the data behind them are a little less. I do think that making sure that you have a robust recommended daily allowance of vitamins is important, particularly when it comes to infectious diseases, thinking about vitamin C, zinc, magnesium, vitamin D, iron. Those are all important, but I usually am recommending that you're getting them from your dietary sources, from a rich diet therein. So that's my approach body-wise, and I don't want to leave out, of course, the mind and spirit, right? So when someone does get COVID, as we talked about earlier, I think there can sometimes be a lot of shame around that, or where did I get it? What did I do wrong? Right? What shouldn't I have done? I shouldn't have gone to that event, I should have worn a mask better. Maybe I should have worn 2 masks. And like I think Dr. Oyola had said, this is not a time for blame and shame. You know, it's nobody's fault. It's the virus's fault, right? And it is what it is. And you know, trying to have some compassion for oneself. I did recently see a study around the fatigue and energy levels of COVID and massage being something that has been shown to be really helpful. And I think that's more than just physical, that's also the touch, right? And even if it's self-massage, giving yourself compassion and love, right, is so important. When your body is already inflamed and fighting something, how do we bring down that inflammation? That is through, you know, compassion and self-soothing. And I think that is vitally important when we're thinking about our immune system and just how to care for oneself when they're infirmed.
I echo all of Dr. Anuj's, Dr. Shah's recommendations and say that, you know, a lot of what, you know, we're reflecting on, you know, in integrative medicine, often our patients are referred to us because they really are interested in supplements and herbs and how that can inform their care. And supplements and herbs, they have a role. They can play an important role, absolutely. But it is also really important to do this safely. And so if you have the opportunity to please sit down with someone to really talk through why is it exactly that you're on that turmeric supplement, what amount of vitamin D is really appropriate at this time, should I be taking, as you know, as Dr. Shah mentioned, these mega doses of these vitamins and these minerals that frankly often, you know, your body is going to get rid of the excess that it doesn't need. And so if you need a higher dose, it's often because you're deficient, but it's first really important to figure out whether you're deficient to know whether you need supplementation. Adding supplementation when you're not deficient can lead to an excess, which can be very unsafe for some of these vitamins and minerals, or it can lead to you excreting it in your urine. And so now all that excess is going into the toilet. And so you've spent $50 on a supplement where really half of it is being wasted. So please, I would say get some, you know, try to get some guidance on this. The Office of Dietary Supplements is one of my favorite resources. And if you go on to the ODS, Office of Dietary Supplements, and in the search box you put in vitamin D, you'll see that it has different kinds of sheets you can look through, a consumer sheet and even a health professional sheet. And it'll give you a list of the foods that are richest in that vitamin or in that mineral. So if you're wondering, as Dr. Shah said really well, you know, how can I get this in my food? You can look at that list and it's a great reflection tool. It can help you, as we were just talking right before this, the Facebook live chat, you know, Anuj and I looked through the list and we're like, oh, we both might be deficient in magnesium because we don't eat any of these foods. So just looking at that list, you'll be able to reflect for yourself, okay, I may be deficient because I don't eat any of these foods, or I'm probably just fine because I eat all of this every day. Okay, so that is a really excellent source for nutrition. Also, the Environmental Working Group will give you a list of the dirtiest fruits and vegetables where it is recommended to get organic, and the cleanest where you don't have to get organic. So if you're buying these foods on a budget, and you have a budget, and we all have a budget, but your budget, that can help you do this in a cost-friendly way too, because we understand that these, you know, these foods can be very expensive. Fruits and vegetables that are organic are extraordinarily expensive. So the Environmental Working Group is a great guide for that. And you know, just a few little things to add. You know, when it comes to cough, I agree, honey, so helpful. But and also any kind of vaporized herbs like eucalyptus. Vapes, you know, vaporized, you know, so pot of boiling water, 5 to 10 drops of the eucalyptus oil. Take a towel over your head. Don't get too close because you don't want to get burned, of course. And then you just breathe in that vaporized eucalyptus. That can be really great for congestion and a cough. And also oregano oil has some antiviral properties. And again, these, like Dr. Shah's mentioned, a lot of this is research that's just coming, and it's not a lot of research on it. But what we've seen so far is that the likelihood of harm is really low, and the likelihood of benefit is there. And so that's why we're recommending these things. Please get the final word and advice from your physician, of course. Okay.
Yeah, when I think about herbal supplements, I generally try to think of them in the ways that they've been traditionally used, right? And I think sometimes they are marketed, repackaged and marketed by again, pharmaceutical companies or other companies which are trying to make a buck, and saying in a way that they're not intended. Well, if a little is fine, if a little is good, then maybe more is better, or maybe mega doses is even better. And that is not the way that any of the traditional ways of either Western herbalism or Ayurvedic medicine or Chinese herbs, that's not the way that they were originally intended. And with thousands of years of research, especially in the indigenous American traditions, in the South Asian and the Chinese medicine traditions, thousands of years of research in their traditional ways, I think, very small doses, likely safe, and I feel comfortable recommending dietary uses, but I do shy away from some of the ways that they're marketed in vitamin stores and things of that nature.
Thanks for all that information. It was super helpful to hear. And I think it's really helpful, I think similarly to COVID and all the information that's going around about that, there's for a while been a lot of information that is going around about nutrition and supplements and where you're supposed to get things from and what to eat and all of that. And it can be really, really difficult to navigate. So it's helpful to hear that advice, and that, either you all as integrative medicine providers or somebody's primary care provider could be a good resource to help kind of sift through all that information. And it's good to hear the robust, the mind, body, spirit approach to treating COVID, because it can be really overwhelming once you've gotten COVID to kind of deal with that, right? And understand what your next step should be. And then similarly to prevention, I'm wondering if you all have heard any myths about treatment methods that maybe aren't as safe, or maybe just don't have research behind them, that maybe are swirling around on the internet. I know, Dr. Shah, we've talked a little bit about marijuana kind of going around as something people are talking about just specifically for COVID treatment. But I'm wondering if y'all have any thoughts or have heard anything else that might be important for people to know.
I've heard patients come to me with certain things. I think someone came to me with a kelp, sea kelp. I have a couple patients who came to me with some sea kelp supplement. Apparently someone in our community is selling this, like gangbusters, because of, it was more than one patient who said, oh, I heard about the sea kelp and they sold it to me, and they're telling me it's going to help me prevent COVID. And no, I do actually look at the herbal literature with pretty consistent eye, and I have not seen any herbal supplement or nutritional therapy that has been shown to do any kind of robust prevention like the vaccine. There is, some interest on a particular chemical in the cannabis plant that may bind to one of the coronavirus spike proteins or of some nature. Very preliminary research, but this does not, the way that science works isn't that if this one chemical potentially does this, therefore, smoking up a lot of pot is going to help treat your COVID. That's not how it works. If it does, that's great, and we'll recommend it. But as of now, I don't see that as being the panacea, and I do hope that there's good research that continues on any possibility to help wherever treatment modalities might come from. But no, I when I look at the basic research, there's nothing in that makes me think that smoking a lot of marijuana is going to help prevent or treat COVID at this time.
It's a wonderful question. I will say that I haven't come across a lot of treatment ideas, therapies from patients that seem very odd or off that I've had to research myself to say, what's the evidence here? I have heard of low dose naltrexone being promoted as something to prevent COVID, and I still have to look through that literature a little bit more, those studies more. And I have heard of sprays, like iodine sprays also, which I think is a little bit unusual. And the idea behind all of that is that there's a lot of alternative medicine that exists, and alternative medicine is medicine that still does not have a very good, robust evidence behind it. And when we say evidence, what we're talking about is, looking at it compared to a placebo with hundreds of people and tracking whatever effect that we're looking for, either prevention or treatment of COVID, as is bring a conversation right now, or lowering your blood pressure, managing your pain, and then looking whether there is a difference, a positive difference. And it's hard to study. It's hard to plug in a lot of alternative medicines into that model, because often alternative medicines like herbs, and not that all herbs are alternative, but for example, herbs were not intended, it was not intended to just take one herb for your cold. It was a combination of herbs. It's called polyherbology, to help you resolve your symptoms of a cold or prevent a cold. And so that's very complex medicine that our conventional ways of studying is very hard to show evidence. So that's why it's hard for us to be able to look through and say, oh, that seems like it would be helpful or not, because often they're plugged into a model that it shouldn't have been plugged into in the first place. It shouldn't have been studied in that way in the first place. And so then we're left with information that keeps us wondering, is this true or not? Is this helpful or not? But in general, what I'd say is COVID, like any virus, causes an inflammation. And if you approach, how would you approach reducing your inflammation? We've just been talking about this. With mind-body medicine, to relax, to get into a state of deep rest and relaxation that already starts to calm the nervous system. So what happens when that happens? Your blood pressure goes down, your pulse goes down, your respiratory rate gets more even. When it gets more even, you get more oxygen. If you get more oxygen, you have relief of your shortness of breath from COVID. And so in eating an anti-inflammatory diet, a diet that's rich in fruits and vegetables and whole grains and seeds and nuts and healthy fats from fish, for example. All of that easier said than done. All of that easier for me to say that than for us to access it. Most of the population can't readily access this kind of food, but that way of eating will reduce your inflammation. Okay, and when you're thinking about things like garlic, onions, those are very anti-inflammatory to add to your diet. If you're thinking about the things that I've heard about, like coconut oil, is coconut oil better, when it comes to your inflammation? Well, coconut oil is better than having butter, but it's not as good or healthier than having, for example, olive oil, right? So you have to look at these foods. And so, yeah, I'm reflecting on the fact that all of these alternative methods are really hard to give clear ideas about whether they're safe or not. And the best, I think, the safest approach is to do an approach of loving yourself, getting enough rest, drinking enough water, attending to your mental health in terms of your therapist, your counselor, your relationships, getting enough sleep, trying your best to get some veggies in there. You know, just like just try to do your best to add a little something positive to your day. The creative arts, so your spiritual health is so important, so anything that you can do to enhance your joyful activities, you know, any joyful activity, that's medicine. So add that into all that will help your recovery from COVID. It really will.
Thank you both. Oh, sorry. And
Yeah, I was just going to say, I love that. And I think such a big part of our self-compassion when we're sick comes from our traditions. There are traditions, you know, when a person is sick, they get maybe chicken soup. Maybe that was something their mom made for them or their grandma made for them when they were sick. And there is some evidence, right, that the liquid, the bone broth, things of that nature, the soup, the vegetables that are in there can be pretty actually nourishing when a person is sick. But there's also the warmth in the soul that comes with that chicken soup, of how it reminds you of mom when you were young, or maybe not, right? And it may not be chicken soup for you. It may be khichdi, or it might be, you know, some lentils, or it might be, you know, heck, it might be a donut, right? Like maybe when you were sick, you always got that donut from dad, and that just made you feel warm and loving. And as much as I don't want everyone to go out there and eat a bunch of donuts when they've got COVID, but if that's something that gives you joy and peace and self-comfort, you're allowed to have some self-comfort when you're sick, and that's okay.
That's right. That's right. Not being so dogmatic about this whole thing, you know, just really, you know, so much I think of what we're dealing with is this, it's got to be this or it's got to be that. And so much of, I think what we're starting to appreciate more over time, especially when it comes to our well-being and our wellness and healthcare, is that it's really the middle way, you know. Both extremes are so hard to sustain and both have some pretty dramatic outcomes, you know. But if we just, you know, 70% of the time we're eating the best that we can, the healthiest that we can in a given week, that's amazing. That's an accomplishment. And I love that, what you're saying, Anuj, that, you know, really not really just punishing ourselves all the time if we're not perfectly eating our vegetables every single day and eating that donut. Eat it with love. Something that I remember learning years ago, that Dr. Weil actually said to me during the fellowship. He said, "You know what, Sonia, it's probably healthier for you to eat your French fries with a little love and compassion and mindfulness, appreciating them, than your salad on the go." Then your salad all rushed and on the go, not thinking about it, kind of shoved, or in front of a computer, and you're thinking, I'm doing such a wonderfully positive thing because I'm eating the salad. But how we eat it with a lot of compassion is, gosh, so important. So I appreciate that so much from you, Anuj. That's wonderful.
that's so beautiful to hear. And I think so important because it can be very easy to be hard on yourself in a lot of different ways in this society and with all of the discourse around COVID. So I really appreciate all of the methods of treatment and the kind of thinking and the way we should be feeling too about addressing this too. So thank you both so much for sharing that. I'm really excited to have Stephanie here with us too. But I just, before we kind of move in to talking a little bit about vaccines with our vaccine expert, Stephanie, I'm wondering if you all have any like last thoughts about integrative medicine specifically that maybe you didn't mention, but might be important before we move to a slightly relevant, but slightly different topic.
I really can't think of it. I mean, I would say that love is medicine. You know, love yourself. Grant yourself the space to be. Grant yourself the space to do the best that you can, and grant that space for someone else. You know, next your neighbor, the person right in front of you. And I think that if that's the intention over everything that we do, we really will be able to heal properly and prevent this and that we're going through this time.
Yeah, thank you. And I would also say along those lines is that give yourself grace, right? If you're feeling stressed out, burnt out, anxious, scared to go out, worried about the future, tense, guess what? It's not you, it's what's going on. It's real. We're in a scary time, and it's anxiety provoking to go out, and can be scary, and allowing yourself that grace that that it's okay, and ask for help when you need it. Ask for help when you need it, and give yourself some compassion.
A beautiful way to kind of round out this discussion. And thank you so much, Dr. Shah and Dr. Oyola, for such amazing and insightful, informative information. It's been really wonderful to hear that. And I know that vaccination has been a big part of this conversation, which is why I'm very excited that Stephanie, you can be here talking with all of us too about vaccines and tests. I think similarly, right? There's been so much information and so much change in who's allowed to get vaccinated, who's able to get vaccinated or boosted, and where to get tests, and all of that can be really swirling around. So I'm going to take the energy from this conversation and like tell everyone to like take a breath because it's very overwhelming. But Stephanie, I'm wondering if you can tell us like where people can get tested, where they can get vaccines, where they can get boosters. Can you tell us how to like find out about all that information?
Yes, I would like to say thank you to Dr. Anuj, Dr. Oyola. The information was very good. I learned a lot, and I really like one of the phrase that I think Dr. Anuj says, be healthy as much as we can. And one of the ways that we can do that is by getting the vaccine, right? So right now, if you are a patient at Heartland Health Center, you can talk to your primary care and schedule a vaccine, your first dose, second booster for your kids at the clinic. If you are not a patient at Heartland, I put some links on the chat where you can find the closest vaccination site of your home. So Chicago, the city of Chicago is hosting different vaccination sites in the different part of Chicago. So I really like that calendar because they have all those options around that neighborhood. So hopefully you don't have to drive too far away from where you live. And another way if you don't have a primary care and you need to get a vaccine, and also, your general checkup with your primary care, you can call, at 773-751-7800. The number is on the chat for you to have access to primary care. If you don't have insurance, don't worry. If you don't understand how to even get insurance, we have a very talented team that can help you walk through how to get insurance and how to have access to primary care. And that way, you also, you have access to primary care, and then you get your vaccinations. And another thing about testing, we have to help, to help spread the virus. So it's very important that we get tested before we go and visit some friends, visit families, members, more those who are with the immune system that's very delicate. So it's very important to get tested. Also, Chicago have different sites. But one of the things that I would like to promote is to order your free COVID-19 test by the government, who is very easy. You click on the link that is in the chat, and it's going to take you to the website. You only have to write down your name and your address. They don't ask no more information, and you will have that one member of the house will receive 4 kits. And also the website have more information if you need to get more vaccine testing at your home. So that's a little bit. I don't know if you have any more other questions. And also I put a number in there. If you are not patients at Heartland, there is a number that you can call, and we are going to help you and schedule and find a vaccination closest to your home. You only have to share your name and where do you live, and we can help you to find where you can, to find, schedule an appointment in the pharmacy, and CPS also have, I need to put the information. CPS also have sites in different schools that you can go as a walk-in. Also, you can do some appointment, but it's easy for somebody that wants to just go and walk in. So yes, let us know how we can help you, and we are here to get you vaccinated.
Thank you so much, Stephanie. It's so wonderful to have somebody that knows all of the places we can go, because sometimes it's really hard to keep track of that. I just want to double check. So anyone can come to Heartland to get a vaccine or a booster, whether they're a patient or not. Is that right?
Unfortunately, right now, we only are vaccinated our patients just because we have staff limitations. So that's why our team, the community health worker in COVID-19, is trying to help the community to find where to go.
Gotcha. Okay. And then Heartland, we have a lot of different clinics at Heartland Health Centers across the north and northwest sides of Chicago. Can patients go to any clinic to get a vaccine, or are they only doing vaccinations at a couple clinics?
They can talk with their primary care and say, I would like to get the vaccine, and they will help you to schedule for the vaccine.
Awesome. Okay. And I know we're putting all of that information about who to call in the chat on Facebook. So thank you so much, Stephanie, for sharing that information. So if anyone needs to get a vaccine or a booster and has questions about where to go, you can definitely call that number. Amazing. Okay. Well, I know it's been almost a full hour. I feel like I could continue to talk to you all for way longer. And I don't know that we have any questions in the chat. So I'm just going to open it one last time before we close out for the day and see if anyone has any last things they want to add. If not, for those who are listening, feel free to still put questions in the chat, or take, feel free to use any of the links that we've put in the chat too. We definitely link to everything y'all have mentioned. So, but yeah, any last thoughts from each of you three?
Thank you all for joining. It's been wonderful. Thank you, Amanda. Yeah, that's my last thought, is thank you.
Perfect. Well, well, I was just going to say thank you so much, Dr. Shah, Dr. Oyola, and Stephanie, for taking some time out of your day to have this conversation. And thank you to everyone who's listening to tune in for this hour on this lovely Sunday afternoon. And I hope everyone has a really lovely rest of their weekend.
Thank you.
Also want to say thank you. Thank you all very much. Thank you, Amanda. Thank you. Thank you, Anuj, and thank you, Stephanie. Thank you very much. And for everyone listening, and be well. We're here for you. You're not alone. Thank you for being there. For everybody else.
Awesome. Thank you, Dr. Ayola. And I second that. So thanks, everyone.